More racers in this year's women's only virtual 5K means more money raised to help even more women get screened for breast cancer. 898 racers raised a grand total of $35,203.58. All that money will help triad women who otherwise could not afford it to have access to life-saving mammograms, resources, and support they desperately need. The virtual race allowed teams to lace up and walk or run at their own pace during the week-long event. You know, October is Breast Cancer Awareness Month, and for To Your Well-Being, we are covering the importance of early detection, screenings, and when and where to get them. Cone Health's Oncology Outreach Manager, Christine Brannock, joins us now. When it comes to breast cancer, how important are these early detection screenings?
It's very important because breast cancer, mammograms can find breast cancer before we can even feel them or we have any symptoms. So it's very important for women to have their mammograms at the recommended intervals.
And who should start getting those screenings? At what ages? When do you need to worry about that?
All women that are age 40 and older should begin getting mammograms every year. If you have a family history of breast cancer, usually the rule of thumb is 10 years prior to the youngest relative being diagnosed. For those that are concerned about, they have a strong family history, there is an option to be genetically tested to see if you carry that gene because it does increase your risk slightly.
Besides the age and the family history, are there any warning signs you need to look out for to maybe know to get tested?
Yeah, so you want to look for things like lumps, any changes in the skin, such as any dimpling. The skin could look like the skin of an orange peel. Any changes of size or shape of one breast, any discharge, any pain. For example, if you feel pain in one spot that you feel with 2 fingers or less. So we're more concerned about focal pain.
And that's for women of any age. If you have these symptoms, you need to talk with someone.
Yeah, so if you ever have any of the symptoms, please consult your physician.
And what do you tell them? What kind of conversation should you have?
You should let them know that your symptoms, then your physician will more likely do a breast exam, and then they will probably refer you to get a mammogram. Typically, if you have symptoms, we do a diagnostic mammogram, possibly an ultrasound, just depending on what those symptoms are and your age.
A lot of people might be thinking, I really don't want to have to pay for this extra doctor's visit. Is there help out there if you can't afford it?
Yes, we have wonderful programs here at Cone Health. We have a couple of different options. One of them is our Mammography Scholarship Program, which, as you mentioned, the Women's 5K, that raises funds for that. And that scholarship is for a free mammogram for those women that are 40 and older that have no insurance and meet those income guidelines. We also have another program called the BSEP program. It's the Breast and Cervical Cancer Control Program. Through that program, women that are uninsured and even some that are underinsured can actually get a breast exam, a pap smear, and pelvic exam, and it covers their mammogram and their follow-up. If we were to diagnose a breast or cervical cancer or certain high-grade lesions, then those patients may be eligible for Medicaid to help with their treatment.
So many of us are just really bad about going to the doctor. Why would you tell someone these mammograms are so important?
Because we can find breast cancers before we can even feel them, and the chance of survival is so much greater if we find it earlier. Also, the treatment options, there's so many more options if we find it at a much earlier stage.
What are some of the differences in treatment options if you find it earlier?
Well, there's different options such as surgery, chemotherapy, radiation. It could be a lumpectomy versus a mastectomy. So it just depends. The rule of thumb is there's no cookie cutter approach to how we treat breast cancer. Every patient is unique.
Well, thank you so much for joining us. We're going to have you back in just a few minutes to talk much more about breast cancer awareness, including what you need to know about if you take the COVID vaccine and getting a mammogram and more. We'll be right back.